who should be concerned? I mean, if people are listening to this at home, obviously, I would say the vast majority of people with sleep apnea are obese or overweight. I would say that the things I look for when I interview patients, I ask a lot of people, do they snore? I look for people with higher blood pressures, especially blood pressures that might not respond to initial medications. Those are some of the things that I look at and I say, this person really needs a sleep test. I also look for people that tell me they don't sleep well. You know, they wake up a lot, they have insomnia. A lot of times the problem is sleep apnea. Who should be concerned about sleep apnea, Dr. Pradhan?
Yeah, I think you covered the main areas. I mean, I think the most common issue is someone will come in and say, "Look, my spouse, my bed partner has been complaining that I snore," and snoring is very prevalent, and it's not that all people who snore have sleep apnea, but pretty much everyone who has sleep apnea snores. But snoring is correlated with sleep apnea, and more specifically, snoring with breathing pauses. So a lot of times a spouse or bed partner will mention that their bed partner is struggling to breathe. Not just a simple snoring, but it's actually like they're stopping breathing, they're struggling to breathe, or they stop breathing altogether. And that's kind of a very telltale sign of sleep apnea that should be worked up. Patients who have chronic fatigue. Those are, sleep apnea plays a big role with chronic fatigue. Patients, as you mentioned, who have blood pressure that's not controlled, or cardiac arrhythmias, common cardiac heart problems like atrial fibrillation are also correlated with sleep apnea, as is obesity. The risk of sleep apnea with obesity is very highly correlated.
And then there are some people that they're not obese, but there's just like, you know this better than I, but there's just like a certain anatomy, right? Like these muscular, big muscular people, they may not technically be obese, but sometimes just anatomically, some people can be more predisposed to it, correct?
Yeah, if there's certain body measurements that are correlated with sleep apnea. The one thing that you can see off the bat is the size of someone's neck. So
Neck circumference.
with a very thick neck, like an NFL lineman, has a very high risk for sleep apnea. I mean, it's an anatomic issue with that amount of weight and musculature. When it relaxes, will just collapse the airway. There's no way you can keep an airway open with that much weight, with the loss of muscle tone and lying flat with gravity working against the airway. So that's a common symptom. And then someone who um, uh, not overweight, there are a lot of anatomic factors that we look at when we just do an examination. Typically, it's kind of the size of their tongue relative to the size of the roof of their mouth. That ratio impacts whether there's airway collapse. Uh, More so in children, tonsil size is correlated with sleep apnea in children, not so much in adults, but it can play a role in adults. And then um, we do specialized testing where we look at the anatomy behind the throat, the ratio of the tongue to the back of the back wall of the throat, and kind of the whole collapsible tissue above the larynx. So there are a lot of anatomic factors that we that as a primary care doctor you can't see.